Good afternoon, everybody. This is Bonnie Vandermeulen, Training Coordinator for Wisconsin Facets. We'd like to welcome you to today's webinar, Traumatic Brain Injury Implications for Education. I'd like to introduce to you today our speaker, Eva Kubinski. She has been a school administrative consultant on the special education team at the Wisconsin Department of Public Instruction for over 10 years. In addition to being the TBI consultant, Eva is the other health impaired and autism consultant. She is also responsible for the areas of American Indian students with disabilities, improving graduation rates, and reducing dropout rates in students with disabilities. It's my pleasure today to introduce to you Eva Kubinski. Eva?
Thank you, Bonnie. And I do have to say that I so appreciate being asked to do this by Wisconsin Facets, and really continuously find out and see how much Wisconsin Facets actually does within our state. So, Bonnie, again, kudos to you and to all your colleagues. Just to clarify, I am the interim autism consultant. We're actually going to be starting to do interviews this week for a new permanent autism consultant. Some of you may have known Daniel Parker, who was our previous autism consultant, who for some reason ended up getting promoted to assistant director, probably because he works very hard and is very good at what he does, and I've stepped in until we're able to find somebody who does that permanently. That being said, I do encourage any of you who have questions either after this presentation related to traumatic brain injury or just general compliance and special education questions to feel free to contact the special education team at the Department of Public Instruction and ask those questions and find out the answers to what you're wondering. Okay, this is going to be the first time where I'm actually directing a GoToMeeting, so I apologize if at any point in time it becomes difficult for you to see what I'm doing. There we go. I'm actually doing this webinar from home. Those of you who are near the Madison area, we have quite a bit of snow and ice going on outside, and I thought that it was a better idea to make sure I was available to do the webinar rather than go in. But we do have a lot that I want to cover today, and again, if you have questions afterwards, we will have an opportunity for you to ask them. If I come to a point in the presentation where it seems a good time to open up for questions, I will let Bonnie know that. Okay, so today what I'd like to cover during this 1-hour webinar, it includes talking about what is traumatic brain injury, what are some of the causes of traumatic brain injuries, how often does it happen in Wisconsin to students during the developmental period, and that's considered from birth up to age 18 to 21. How does it manifest itself in children or in the students you might work with if you are an educator? How do we or can we support our students with traumatic brain injury? And who are the outside supports that may be helpful to call upon? I've also included a couple of slides that have some resources that you might find useful. They're just examples of information that's out there because there is quite a bit. And again, if at any point in time, now or in the future, you have some questions, feel free to contact me directly. Okay, part of the reason I wanted to talk about the definition of traumatic brain injury is that part of my job at DPI is to answer questions from parents, from educators, from evaluators about traumatic brain injury. And sometimes there seems to be some misunderstanding as to what it is. The formal medical definition, which in the last few years it appears has been narrowed down, is that it's a non-degenerative, so that means it's not progressing, non-congenital, so it wasn't something you were born with, insult to the brain from an external mechanical force. So again, remember that external piece, possibly leading to permanent or temporary impairment of cognitive, physical, and psychosocial functions with an associated diminished or altered state of consciousness. Now, you will probably find other similar definitions online. This is just one that I found from Medscape, but it's very similar to ones that you will see in other websites. Now, it can result from a closed head injury. That would be, again, having an external force, but not causing a penetrating type of injury. So this could be if you were in a car accident and your head snapped very suddenly. Your brain would continue to move even though your skull wouldn't, and that could cause bruising and injury. Or, as I said, the other one would be the penetrating head injury. That's something if you actually have an object piercing the skull and entering and damaging the brain tissue. Now, one of the things that happens in Wisconsin is that when we define a disability area, and this usually comes after the federal U.S. Department of Education comes up with a new area, we then put that into statute. So again, if you look at your slide, you can see that it says there's an acquired injury to the brain caused by an external physical force, and that's my emphasis, and then resulting in total or partial functional disability or impairment. And again, this isn't going to be something that happens that are injuries that come from birth or degenerative injuries or injuries caused by the actual birth trauma. So it's really being very specific in defining what happens. Now, I've had parents contact me and want to say that something like a stroke or some other kind of birth anoxia where your brain is deprived of oxygen would be considered a traumatic brain injury because of another term that comes up. Again, and we'll come up to that term, which is called an acquired brain injury. We'll talk about what that is in a moment. Now, this is another part of that TBI statute, talking about children whose educational performance is adversely affected. So again, remember when we talk about special education, and that's what the statute is talking about, we not only need to see a disability, but we need to see some kind of impact that is going to impair the student. So again, what it's saying here is that if it's caused by internal occurrences, such as vascular accidents, which an example is either an aneurysm or a stroke, infections, anoxia, which is the deprivation of oxygen, tumors, metabolic disorders like phenylketonuria, and the effects of toxic substances or degenerative conditions may meet the criteria of other impairments. It could be that child would meet the criteria for other health impairment, for a specific learning disability, for emotional behavioral disability, for an orthopedic impairment. There are lots of other possible areas that that child may meet that definition. But if it's an internal occurrence, or again, as it said, one of those other degenerative conditions, it would not be considered a traumatic brain injury. One of the third part that is a reminder to those of us who are going to be evaluating a student who may have a traumatic brain injury is that you can't really necessarily say for sure that the results you get are going to be reliable or valid, because of standardized and norm-referenced assessments are normed on students in general who do not have traumatic brain injury. So therefore, it's really important to gather a variety and breadth of information, making sure that it's not just one or two tests, but that you're getting information about what's happening in the classroom. What are the parents seeing at home? What does the student see or know? And pulling all of that together so that you have a good depth of assessment results to help you make sure that what you're looking at is the impact of the traumatic brain injury. Okay, so remember what I was saying. Sometimes I get calls from parents who really wanted to make sure that we said, yes, this other cause resulted in a traumatic brain injury when it didn't. Part of that is because a traumatic brain injury is an acquired brain injury. That means it's something that happens. But not all acquired brain injuries are traumatic brain injuries. We had, and I will be updating it, we had a series of frequently asked questions about TBI, and there was one answer that was a little bit fuzzy, where it said that a traumatic brain injury is an acquired brain injury, but it did not clarify that there were other types of acquired brain injuries. So again, those other types of injuries are not considered traumatic brain injuries, either for the medical diagnosis or for the educational diagnosis. Now, one of the areas that's been really getting a lot of news in the last decade is the area of concussions. A concussion is one type of traumatic brain injury, and it's one of the ones that we're actually required to now take a look at and work actively at preventing in statute. A concussion can be caused by a bump or a blow or a jolt. Remember, what I actually described was the impact of a car accident where your head kind of causes the brain to bounce around. And what is interesting to me especially is that 90% of concussions do not involve a loss of consciousness. A few years, actually more than a few years ago, about 8 years ago, I went outside on a lovely February morning to get my newspaper, did not realize that there was black ice on my driveway, and ended up slipping and falling and hitting my head on the cement. Until that time, I didn't realize what kind of a thunk your brain makes when it hits cement. It was not pleasant. I did not lose consciousness, and I was actually planning, other than the fact that it was painful, to ignore it. Luckily, I did not. I did not end up with a concussion, but I was advised that that was a very strong likelihood because of the type of accident. So it's really important to not assume just because somebody does not lose consciousness that they did not get a concussion. So we have now in statute 118.293 a concussion law. And what the law actually says is that that any youth organization that has for sports has to educate coaches, athletes, and parents on the risks of concussions and head injuries, and then prohibit the participation of an injured participant until the athlete and parent or guardian have returned a signed agreement sheet showing that, not even participation before an injury, any participation in an activity until they've signed an agreement regarding not participating. Bonnie, did you need? I'm sorry, Bonnie, did I hear you, or is that?
No, it wasn't I.
My apologies. So again, and the agreement is that if that student athlete is injured during a game and there's a suspicion of a possible concussion, then the law requires that must be an immediate removal of that individual from that activity. Again, if the symptoms indicate a possible concussion has been sustained. So that means that the coaches have to be trained in what that might look like. And then if they determine that there was a concussion, that student cannot come back in until they've been cleared by some kind of health care provider. And I think that's incredibly important because we know that it takes a while for anybody's brain to recuperate after a concussion. So again, they're usually temporary and they may resolve without having any kind of residual problems. However, what research is showing is that the symptoms in children and adolescents take longer to subside than in adults. So whereas an adult might be able to come back in a few days, a child may have to wait longer in order for the symptoms to subside and also potential ongoing damage. One of the things that they have seen is that the brain is very susceptible to repeat injury in the period right after a concussion. So what they're actually looking at is, in terms of the symptoms that you might see in a child or youth athlete who's sustained a concussion, is having a headache, difficulty concentrating, memory impairment, sleep disturbances, and other general academic problems. One of the things that they've also found is you not only need to potentially avoid physical activity, but also mental and cognitive activity. I can't speak to that in any great depth at this time. It's something that a medical provider would provide more information, but it is something that's been coming up in the literature.
As you're pausing now, Eva, I do have a question if you don't mind, because it's on the section that you're going on at this point in time. Is it okay to take it now?
Absolutely.
Okay, the question is, if it's not considered to be a TBI, then what category does it fall under?
So if it's not considered a traumatic brain injury, it would actually, then you would want to look at what kind of impairment or impact it's having on the child or the student. So that's, again, it may be that becomes an other health impairment, or it could be a specific learning disability, or it could be an emotional behavioral disability. It's something that you, again, want to have the IEP team gather a lot of information and take a look and see what areas it falls under. In general,
I'm sorry,
yeah,
so the questioner just wrote back and said this was part of an infection that took place, and so it was like a medical issue.
Yes, that my suspicion, and again, not having been part of the IEP team, but I would probably have, if I were the person to receive that referral, I would probably be looking at other health impairment.
Okay,
but again, if, for example, it was an infection that then caused some kind of mobility disturbance or significant balance issues, it might also be an orthopedic impairment. So again, it really would be determined by what's happening in terms of the impact of that infection.
Thank you.
Thank you. That's a great question. I appreciate that was brought up. Okay, so I did try to make at least a few of my slides a little more interesting, and this is my attempt. The leading causes of traumatic brain injury vary depending on the age of the child, and this goes all the way down to infants, and unfortunately we do see it in terms of being caused by abuse or neglect. In toddlers, it may be abuse, but then it also starts to be potentially falls because, you know, they're trying to get around and they aren't always the most efficient of walkers. In early elementary, it tends to then be falls, pedestrian and motor vehicle accidents. So being actually hit by a vehicle. In late elementary, middle school, then it's pedestrian bicycle accidents and pedestrian motor vehicle accidents and sports. So again, you're thinking about what where students are going to be and what they're doing that might put them in greater risk. In this case, you're seeing more independence. They're going to have more opportunities for it to happen. And then at the high school level, primarily motor vehicle accidents. Now, that's not to say that there aren't other ones. I had a very good friend who suffered a traumatic brain injury twice, one in a bicycle accident and then a second one because as a result of his traumatic brain injury, he didn't always have the best, I'd say, executive functioning in terms of figuring out what he should and shouldn't do, and was climbing up some closed bleachers in my high school and fell off from the top and ended up, again, injuring his brain. So, again, it can happen for a variety of reasons, but what we always want to look at is what is the actual then impact in terms of the symptoms that come from that injury. Now, this actually surprised me a bit. I thought because of how much we've talked about brain injuries in Wisconsin, especially around concussion, that we'd have quite large numbers. But actually, traumatic brain injury is one of our smaller groups. At this time, we only have about 297 students in our schools that are identified as having a traumatic brain injury and receiving special education services. Now, that's not to say that there might not be students who had a traumatic brain injury but are receiving it under other areas. But at this time, we actually have, as you look at this chart, the number of students varying. Now, I do kind of wonder, you kind of take a look at that grade 5 through 12, and is that because we had a lot that happened 5 to 10 years ago, or is it that these are recently identified and you're just seeing it because there are more opportunities for them to obtain it? Not something that we could find out at this point in time, but again, an interesting question as we look at the data. And again, this is also, just for your information, this is data that is coming from our WI system. It's not something that you would be able to do through our WI public data system. This was something that came from our secure information because of the small numbers and the risk of identifying individual students. Okay, so I apologize for the tiny print on this slide, but hopefully you can actually see it. There are different things that manifest themselves when you look at traumatic brain injuries. And again, going back to the question from the participant who was talking about an acquired brain injury from an infection, you may see similar symptoms. Under physical impairment, you might see impaired speech, impaired vision, hearing, headaches, problems with motor coordination. So again, as I'm talking about this, I'm thinking if it were misidentified, I could see other disability conditions where the student might be identified. Spasticity of muscles, meaning that you're having trouble controlling it and then having the muscles be less mobile and less able to work the way that they should. Some paralysis, seizure disorders, balance issues, and fatigue. Now, again, all those things impact how the student is able to progress and be successful in school. We also might see cognitive impairments, including short-term memory deficits, trouble with concentration, slowness of thinking, having a limited attention span, having difficulty with perception and with communication skills, having trouble planning, not knowing what steps to take to actually complete an activity, having difficulty writing. Writing is not an easy thing. We have not been doing that very long in our evolutionary history. So, that's one of the things that we'd have more difficulty with because we might not have redundant systems in our brain to take over if it were if the injury was in an area that was related to writing, or with reading, or with judgment. And then you also might see emotional impairments, mood swings, denial, self-centeredness, having anxiety and depression, lowered self-esteem, sexual dysfunction, restlessness, lack of motivation, and difficulty controlling emotions. So again, as I look at this, part of me starts thinking about some of the students that I've worked with in the past who had, as I look back now, probable traumatic brain injuries but had been identified in other areas, and how this would impact how they would do. They might get into trouble because they didn't think through what the consequences may be. Or you might see a lot of emotional volatility. They might get angry very often and very easily. And one of the things that I always bring up is that one thing that I don't think we always think about, especially in the education setting, is the idea of grief. When this happens or when it's recognized, because oftentimes it happens suddenly. It often happens after a period of normal development, and oftentimes the student themselves knows that there's a difference between what they used to be able to do and what they can do now. Now, again, as I talk about these impacts and what it might look like for kids, it's important to recognize that there's going to be an extreme amount of variability. It's going to depend on the severity of the injury. It's also going to depend on where along the period of healing the child may be. It's also really difficult to predict what might be the long-term outcome for any child. With early diagnosis and ongoing therapeutic intervention, the severity might decrease to a varying degree. So it is possible that by providing that type of therapy and providing intervention, the impact of the brain injury might be reduced. But again, it is really important to know that you might see it in more than one area. You might see it in both physical impairments and cognitive impairments, or you might see all three areas, or it might just be one. It all depends on where in the brain the injury actually happened. Now, I did mention that sometimes you might end up having a student with an acquired brain injury diagnosed as having a specific learning disability. There are differences when it comes to traumatic brain injuries and a specific learning disability. And I think that's one thing that it would be important for IEP teams to tease out. Because again, the traumatic brain injury, that's happening very suddenly. And that's why for students who may have had them at a younger age, it's always important to get a history and make sure that we know what had happened in those earlier ages that might be causing the resulting learning or social difficulties a student may have. Traumatic brain injury can happen at any time, but a learning disability is often diagnosed at an early age. We'll see the indications of a learning disability early and consistently, as opposed to a traumatic brain injury, which may happen later on. The traumatic brain injury can also interrupt the development of a child's brain, whereas the specific learning disability is something that is usually thought to either be birth-related or a congenital disorder. And oftentimes with a specific learning disability, you may see that there are other relatives of the child that have also some form of specific learning disability. So again, that history is always important to get. For traumatic brain injuries, we might not see an impact till later on, even years after the student had that injury. And again, if you have a traumatic brain injury, you're going to see before and after changes. And again, that's not necessarily something you'd see with a specific learning disability. There's not that kind of dramatic difference before and after. And what you may see with a student with a traumatic brain injury is there might be areas where they can do just fine, and then there's other ones that show some impairment. Whereas with a specific learning disability, you often might see that it's going to be impacted across all areas. And then students with traumatic brain injuries may have uneven and unpredictable progress versus a student with a specific learning disability where it's going to be a continual impact on the student's academic performance. And I did provide for you at the bottom of that slide, where I got this information from, and I do have a link to that document at the end of the PowerPoint. Now, this is the TBI checklist. This is what IEP teams use to identify whether or not a student with a suspected traumatic brain injury qualifies for special education. So again, if you're going to be considered in Wisconsin to have a traumatic brain injury as a student, what the IEP team is going to have to look at is, does the student have an acquired brain injury that occurred following a period of normal development, and again, it can't be something due to congenital causes or degenerative causes such as muscular dystrophy or multiple sclerosis, or induced by birth trauma such as a perinatal stroke. The next question that the IEP team needs to answer is, was the student's acquired brain injury caused by an external force, from a strike or a blow to the head, or from movement of the brain within the skull? And that could be due to again, a bike accident, a fall, a sport injury, some form of childhood abuse, or some type of penetrating object like a nail, or unfortunately, this happens in some of our communities through some kind of gunshot wound, or something such as whiplash to the head. And again, you can actually have that through a car accident, a bike accident, or some kind of fall. And then the third question that the IEP team has to look at to say whether or not the student has a disability in the area of traumatic brain injury is whether the student's educational performance is adversely affected due to total or partial functional disability or psychosocial impairment, or both, in one of several areas. And then in the next slide, I've actually written those out. Those could include, and I apologize, the cognition and speech and language are not headers. They just happen to be the first ones that I put in there. But things like cognition, memory, reasoning, communication, problem solving, physical functions, psychosocial behavior, attention, abstract thinking, judgment, sensory perceptual motor abilities, information processing, or executive functioning. So again, these are a lot of different areas where you could see an impact. You don't need to have all of them, but these are what you would look at to determine if the student had a disability in the area of traumatic brain injury. And then, of course, there's the big question, does the student's disability cause them to require specialized instruction and supports, that is, special education? Always an important part of an IEP team evaluation, one that I know when I was in the schools tended to be less focused on, but it's a very important one, because you may have a student with a traumatic brain injury, for example, maybe a student who suffered a concussion as part of a sports activity, and they may show impairments in those areas that I just talked about, but it's not to the level of severity that they require special education. So one of the other things that the IEP team or whoever made the referral could do is also do a concurrent Section 504 evaluation to determine if there are any accommodations that might be required for that student, but that did not rise to the level of the specialized instruction and supports that we provide within special education. Okay. Bonnie, the slide or the screen's frozen up.
Oh, okay.
Yeah, let me see if I've got, okay, I'm still able to screen share, but for some reason I am not able to move forward. So I don't know if that's on your end or mine.
No, I think it might be on your end there.
Okay, let me see if I can.
Maybe go backwards from your screen.
Oh, there it is. Okay. It looks like that.
There you go. There you go.
Yep. Yep. Before we continue, are there any other questions that might have come up? I know that was a lot of dry information, but I think it's important to know what we look at when we're looking for that diagnosis, educational diagnosis.
There is one question, and I wonder if maybe you can just address that, and that's the questioner knows of someone who had to have brain surgery to remove a tumor. could the result of that be a traumatic brain injury, or is this something that would be considered something else?
Everything that I've looked at, again, because it actually specifies tumor as one of the ones that is not considered a traumatic brain injury, plus the fact that the surgery to remove the tumor was a result of the tumor, that would probably be considered, I suspect, another health impairment rather than a traumatic brain injury. But again, it's always an IEP team decision. But I think that if the IEP team was going back to the actual definition, they would not be able to call it a traumatic brain injury.
Okay, and we do have another one. What type of training in this area do special ed teachers need to receive? And do they get professional development as far as programs that, are evaluated in this area?
Sure. I'm sure that they get some information about what it looks like and how that impacts a student, but because a lot of those things I talked about are things that we already do within, that we can address within special education. They just may not be all at once. Oftentimes our teachers with those cross-categorical licenses, or even in some of the other areas, would all be able to provide that assistance and the additional support to support a student with a traumatic brain injury. Now, again, if there's a higher level of severity, that might be something that a teacher would